Hi, my name is Gaynor Morgan. I'm a fitness instructor, a science of stretch teacher, and a breathing coach. So today I want to show some effective ways of how to control urinary stress incontinence in women. So while we are sitting down, I just want to give you a little anatomy. So here's your pelvis, and if you feel at the front here, you've got sticky out bones. So these are the ASIS, the anterior superior iliac spine bones. So that's when we're saying, let's put the ASIS forward. We want these bones facing forward. Then underneath, where we sit down, so if you just feel around at underneath here, you'll feel two bony landmarks either side, and these are the ischiotuberosity bones, or otherwise known as your sits bones. These bones actually do widen in a squat and narrow when we stand up. So the pelvis is made up of 3 layers of different kinds of muscles, all going sideways and from front to back. It's important in our bodies that we allow the bones to stretch and relax one way and also the other way. So here, as I'm sitting down, I have to allow the muscles to be able to elongate and come back. Same with the sit bones, or the front bones and the back bones. So when we squat down, these ASIS bones, as we bend down, the bones are going to widen, and as we stand, the bones narrow. And the opposite happens in the front. So as we're standing, they are wider, and as we bend down, they start to narrow in. Why am I talking about this? Is because a lot of women with urinary stress incontinence, they come into a different pattern where it not only weakens all of the structure of the pelvic floor, but it also can weaken the structure of the urethra, that little tube that allows urine out of the body. We can strengthen all of the structures, and one way that you can do this, and you can even do this if you've got an office job, is to get a Pilates ball. And we're going to start strengthening the inside of our legs, which are the adductors, so the adductors. These muscles here really help with the urogenitalia. So where we've got stress incontinence, doesn't matter how many Kegels you end up doing, if these muscles here are not strong enough, especially the adductor magnus, that feeds into the muscles that help then with incontinence issues. So we need to be strengthening everything. So one simple way to do this is you sit down with your feet planted on the floor, parallel, and you're going to take your ASIS bones to start with, the sticky out bones. They're going to be pointing forwards. You can have a nice long spine, and the sits bones, make sure that you're sitting square on your sits bones. So no hip hiking, just square on the chair. So the first thing we're going to do is, in this position, we're going to take the ball and we're going to put it just above the knees. So you've got a lot of tendons and nerve endings around the knee joints. So that's why putting it up a little bit further, so we're not putting pressure on the inside of the knees, just in case anybody has got knee problems. So coming from here, now I'm going to show you from the side what that looks like. So on the side, nice long spine. So we want to work on diaphragm as well. And as we inhale, so keep your shoulders still, because we're not breathing with our shoulders, we're breathing with the diaphragm. As we inhale, the diaphragm descends and it moves the intestines outwards. That's why your belly swells up on the inhale. That relaxes the pelvic floor. So here we've got that elongation of the muscles. Now, on the exhale, so some people might want to blow out candles. Imagine you've got a candle, 90 candles on a birthday cake in front of you. So you're going to purse your lips. That controls the air coming out. So it slows down the air and it also helps contract the pelvic floor. If you don't feel any contractions in the pelvic floor, that's perfectly okay, but it is contracting, I promise you. If you can't blow out candles or you don't feel comfortable, the other effective way is to say yes and really elongate that S. So it's, as you elongate the S, the abdominals will start to contract and get stronger. And you will feel, if you just put your hands here now and just say yes, I'm not sucking in my belly, that's the air and the diaphragm helping contract everything below the belly button. So with the ball, we're going to squeeze on the yes, and we're going to just relax then as we inhale. So on the yes is our exhale. So nice long back. Remember to keep your shoulders still. So when we inhale through the nose, we don't want to be doing this. We want to be doing this. So inhale. Exhale. As you tighten and tighten, you're going to feel the glutes, your butt muscles tightening up as well. So everything that feeds up into the urogenital triangle is now tightening. Inhale, relax. And again, exhale. Inhale. Now you can do that 3 or 4 times. The next one, so here's us sitting square on our sits bones. Now the next round you're going to do is you're going to do an anterior tilt. So doing an anterior tilt, you've got more of the perineum sitting on the chair itself. People who can't feel the pelvic floor contract, this is maybe one way that you can start to activate that pelvic floor. So I'm just going to show you from the side. So we want to go into an anterior pelvic tilt. So imagine you've got a cup of coffee here and we want to spill it out. So from here, we're sitting square. Now into our anterior pelvic tilt. So our tailbone comes up, the pubic symphysis goes down. Same thing again. So inhale through the nose, belly up comes out. Exhale, pressing the ball. You really can feel these sit bones widening in this position. Inhale, stay in that tilt. Exhale. Squeeze the ball till there's no air left. And relax. Do that 3 or 4 times. Now, the other way, so anybody who's got a cystocele or an anterior pelvic floor, pelvic organ prolapse, they may benefit from that anterior tilt. You're going to have to play around in your own body to see what suits you. There should be no sharp shooting pains. There should be no pains coming in the spine. If you do have any pains, or if anybody's got pudendal nerve damage, and you find that you're going to have, you may have some triggers going on, then please stop. Always, always see a physiotherapist for further help. So this is just kind of basic stuff that I'm doing. So now we're going to do a posterior pelvic tilt. So this time, so anterior, neutral, posterior. This time, This is really good for those who have got a posterior wall prolapse as well, such as erector seal, complicated by urinary stress incontinence. So as we're in our posterior pelvic tilt, exactly the same thing. Nice long spine. Inhale. Exhale, squeezing the balls. And you're going to flex your spine a little bit more. So the spine comes into flexion as you're exhaling. Inhale, just release that little bit of extension in the spine. And back in again. Exhale, pelvic tilt. Really bring that tailbone, that coccyx under, pubic bone comes up. Feel the tightening of the pelvic floor. So these are a couple of methods that I find particularly useful for clients with urinary stress incontinence. Hope you find that helpful too.